Hey everyone, how are we doing? Today we are covering the shoulder again, except this time we're going to look at the ligaments as well as the muscles. So let's get into it. Okay, so I've pulled up upper limb region right here and you can see our shoulder. Alright, I've pulled up a model of the upper limb. Now we're going to zoom in on the shoulder region because that is what we are focusing on today. And if I put level 1 connective tissue on, you can see this pop up. So here you can see the synovial capsule that covers the joint, the glenohumeral joint in this case. And the purpose of the synovial capsule, it's made of synovial membrane. And what that synovial membrane does is that it produces synovial fluid. That fluid lubricates this joint and allows it to move smoothly. Not only that, the synovial membrane protects and ensures there's no gaps around the shoulder joint, so nothing get in or out. You can also see this little thing here. This is a tendon sheath and it covers the tendon of the long head of the biceps brachii. The purpose essentially of these tendons here is for a smooth transition and prevent any friction against the bone of the tendon. Otherwise it would wear out pretty quick. Within this tendon you've also got synovial fluid that also lubricates as you move your arm up and down. Now in addition to these, we've also got this joint up here that you can see this little bit of cartilage that appears. This is the coracoclavicular ligament. The way we name that is it attaches from the acromio and it attaches to the clavicular. Okay. That's how we get the coracoclavicular ligament. Now this joint here stabilizes the AC joint as well as increases that joint congruency. We can see here that it's a plane joint, so the two bones slide past each other like this. It's not over the top, it doesn't lock in, it's just a plane joint. And so these are inherently unstable, and so they need a ligament here in order to hold it together. If we increase the layers up by one, we can see all these ligaments here that form. Okay. Now these ligaments here, they come from the glenoid labrum or thereabouts, okay, which surrounds the glenoid capsule, and they attach onto the head of the humerus. Now this one here, since it's above everything, it's called the superior glenohumeral ligament because it comes from the glenoid cavity and it inserts on the humerus. And so this one would be the middle glenohumeral ligament, and then the bottom one would be the inferior glenohumeral ligament. Now the purpose of these ones is to prevent too much anterior movement of the humerus. So movement forward prevents the humerus from dislocating this way. Okay, and it provides that extra bit of support. Now if we increase the layers by one, the connective layers, we can see this capsule, another capsule forming. So this is the outer fibrous layer of the joint capsule. So the whole idea of having this external fibrous joint capsule is to prevent any of the synovial fluid from coming out. And it also just seals off this capsule in general, providing that extra bit of stability, which with the shoulder, due to it being quite a shallow cavity, we need all the support we can get in order to prevent this head of the humerus from dislocating from the glenoid cavity. We can also see that in this level 3 connective tissue, we can see this new tendon up here that forms. Okay, so it goes from the coracoid process down to the top part of the humerus. That's what gives it its name, coracohumeral ligament. So it attaches to the coracoid process and it inserts on the greater and lesser tubercles of the humerus. So the whole idea of the coracohumeral ligament is to prevent superior and inferior displacement of the shoulder at the glenohumeral joint and provides an extra bit of stability. We can also see this other ligament here that goes across the tendon sheath for the long head of the biceps brachii. This is known as the transverse humeral ligament. Okay, now so the importance of this transverse humeral ligament is that it prevents the biceps brachii tendon, the long head, from subluxating or partially dislocating from the intertubercular sulcus. If the tendon of the long head of the biceps brachii tendon subluxated often, it would rub along the greater and lesser tubercles, causing inflammation in that area, as well as uneven lifting patterns because the tendon could snap in and out of the intertubercular sulcus. Now, fun fact, we can see, if we look at the shoulder joint here, we can see we've got this redundant pouch right there. So that's a redundant pouch in the fibrous membrane in an adduction. So adduction means bringing your arm in. Okay, the reason why it's there is because when we abduct our arm, this part here, the arm was going to move up and this part here is going to stretch. So it allows us to move our arm up like this. Okay, otherwise in the adducted position, it's going to have a little bulge right there. Okay, so now we'll go to level 4. So this first one we can see goes from the coracoid process all the way to the acromial process. So we get the coracoacromial ligament. Okay? And the purpose of this ligament here is to stabilize the AC joint, as well as preventing upwards dislocation of the humerus at the glenohumeral joint. Because let's say the humerus dislocates superior, this ligament here can prevent that, or at least stop it from going worse. We zoom in, we can see this ligament right here forms, okay, and it creates this gap here. Now this ligament is transverse. A main point in the scapula is it's got its spine. Anything above it is considered supra, anything below it is considered infra. Okay, so in the case of this one, this is going to be a suprascapular ligament, but it's also transverse. So it's going to be the transverse suprascapular ligament. What that allows is to create this suprascapular foramen, which is necessary for suprascapular nerves and blood vessels to travel through. Now, in addition to these ligaments, we can also see this ligament over here that forms. This here is called the sternoclavicular ligament. So it connects to the sternum, specifically the manubrium of the sternum. It stabilizes the clavicle and the AC joint when it moves. Now, there's one last point to mention on this level 4, is this point here. This is a bursa, specifically a coracoclavicular bursa, because it's between the clavicle and the coracoid process. The idea of these bursas is to prevent great friction between bones and tendons, and it allows them to be freely movable. Otherwise, they would rub a lot of the time, and that obviously wouldn't be good for longevity. Now let's go up to level 5. So we can see in level 5, we've got a couple of new tendons. So we've got these two here. We can see here in level 5, that we've got this group of ligaments that come from the coracoid process up to the clavicle. Okay, so we've got one here and then a second one over here. Now this first one here attaches anteriorly to the coracoid process, and it inserts on a special line that we call the trapezoid line. Now we can see it a bit here. If I zoom down, you can see there's this little raised area and a little bit of a line there. That's known as the trapezoid line. And so this is actually the trapezoid ligament. Okay. Now we've got the second one over here. So this second ligament back here, we can see it comes up and it attaches at this little divot here. Okay. If you remember from lecture 1, this little divot is the conoid tubercle. Okay. So this ligament here is going to be the conoid ligament. Now let's move on. Let's go to level 6. So in level 6, we can see that all these bursas form. As I explained before, bursas reduce friction of tendons and ligaments and bones when they move a lot to prevent the wear and increase longevity, right? So these bursas here, there's a lot of them, as you can see, and that's because this area is full of muscles, specifically rotator cuff muscles. These rotator cuff muscles are very important in stabilizing the joint, so it remains important that we have these bursas here so that they don't wear on each other. So there are all the ligaments we covered, and so now we'll move on to the muscles. So let's get rid of all this and move on to the muscles. Okay, so we actually have to go up to the 3rd level in order to see any muscle. But yeah, we can see a couple of muscles form around the shoulder joint. Now, we're only going to be covering shoulder joint muscles, so no biceps brachii muscles or triceps brachii muscles today. So first of all, we can see this muscle right over here. You can see it goes from under the clavicle and it attaches on one of the ribs. That is why this muscle is known as the subclavius muscle, because it's under the clavicle. And as we can see, it attaches in this little groove here, which we talked about in lesson 1, which is known as the subclavian groove. Okay. Now, if we move over to the shoulder joint, we can see there's a few main muscles that appear. So anteriorly, we see these muscles here. Okay. This is known as the subscapularis muscle. Okay. The reason why we call it the subscapularis muscle is because this fossa on this side of the scapula is considered underneath the scapula. A good way to remember that is when you bend over, right? This under here is technically underneath us. So our anterior portion is underneath us, whilst our posterior portion is above us. Okay, so we call this subscapular fossa, which we covered in our first video. That is what gives the name subscapularis here. So subscapularis originates on the subscapular fossa of the scapula, and it inserts on the lesser tubercle of the humerus up here. Now, its main function is to help with medial rotation of the humerus at the glenohumeral joint. Okay, as we can see here, it pulls on this side and it'll medially rotate that ligament. as you can see, it pulls on this side and will immediately rotate the humerus. Now if we go to the other side, we can see there's quite a few more muscles. Okay, so we got this one here. Now this is known as the teres minor. Now we can see this one here. This one here is known as the teres minor. You can see it inserts on the posterior portion of the scapula, known as the infrascapular fossa. Okay, and it inserts on the lesser facet of the greater tubercle. Okay, so we know that this is the greater tubercle, and we can see these little divots. So we've got one divot here, one divot here, and one divot here. So this is the superior facet, because that's where another tendon attaches to. This is the middle facet, because it's in between them, and this is the inferior facet. If we go back to the teres minor, it attaches to that inferior facet, and due to its position of attachment, it can laterally rotate the shoulder. We can also see another big muscle, and this is called the infraspinatus. Now you're wondering, why isn't it called the infrascapularis? The reason why is because it attaches to the spine of the scapula here, and it's also under the spine. So when we're looking at the posterior portion of the scapula, we refer to the spine as the main point, and so we're above the line, known as supraspinatus, or below the line, which is called infraspinatus. So in the case of this muscle, it would be called the infraspinatus muscle. As we can see, it originates from a bit of the spine as well as the infraspinatus fossa, and it inserts, we can see it inserts over here on the middle facet of the greater tubercle of the humerus. Now if we come back to the scapula, we can also see one large muscle at the top here. This is called, remember what I said before, supra, it's above the spine, so it's going to be the supraspinatus. Now this originates, if we take this muscle off, it originates from the supraspinatus fossa, and it inserts on the superior facet of the greater tubercle, as we can see here. Now, unlike the other ones, which are attached kind of on the side, this one's attached on the top, so it's going to abduct the muscle or raise it up like this. But there's a key about the supraspinatus. Due to its small size, it only helps raise it the first 15 degrees. Because past that, it'll just pull the humerus in, and we don't want that. We want to pull it up like this. Okay, so it only helps with the first 15 degrees of movement. We'll skip straight to level 5, because level 4 doesn't have any main muscles that we need to cover. Okay, so we'll go to level 5, and level 5 you can see a few that come up. So we can see this muscle here that's tucked behind the coracoclavicular. Okay, so we can see it right here, and it originates from the inferior angle of the scapula. Okay, so maybe if I go around we can see it a bit clearer. So we can see it originates from the inferior angle of the scapula. Okay, and it inserts on the medial of the lesser tube. Okay, so here's the sulcus, it inserts on the medial lip. Okay, this is known as the teres major muscle. Now if we go back here, okay, we can see it's just below the teres minor. And teres actually means cylindrical. We can see that these muscles here kind of have a circular shape, or a round-ish shape. Now the function of teres major is a little different to teres minor, purely because the way it attaches. Now we can see that teres major actually inserts on the other side of the humerus, okay? So it'll help with medial rotation, as well as helping adduct the humerus, so bring it towards the body. Now we can also see this muscle here. So this muscle here is known as the serratus anterior, and it's quite a large muscle. It originates on all these costal ribs here, and it inserts on the medial spine of the scapula, as you can see over here, on the medial spine of the scapula. So when we reach out, okay, like this, when we reach out our arms, it'll pull the scapula this way. So it'll protract the scapula, as well as upwardly rotating the shoulder joint. Now we'll move on to a few more niche muscles that help with the shoulder joint. And so we can see this one here. This is known as the pectoralis minor. So it's under the pec major, which we commonly see. And so the job of the pectoralis major is to protract and downwardly rotate the shoulder. And so it'll look like this. When I rotate my shoulders forward, that's what the pectoralis minor is doing. It's helping rotate my shoulders forward. Now so far, a lot of the muscles we covered, including the infraspinatus, the supraspinatus, the subspinatus, as well as the teres minor, they're all rotator cuff muscles. Now, I'm quite sure most of you have heard the term rotator cuff. And the whole point of those muscles is to stabilize the shoulder joint, because as I mentioned in previous videos, the shoulder joint is very shallow. The glenohumeral cavity is very shallow. And so it needs a lot of muscles and a lot of ligaments to stabilize that joint there. And so essentially what these rotator cuff muscles do is they proximate the humerus or pull it towards the glenoid cavity, okay, and prevent it from dislocating. And that's why when you hurt your rotator cuff muscles, it can be quite significant because your shoulder or humerus will become unstable. Now, increasing the layers, we can see that this new muscle forms up here. This is known as the deltoid muscle, and it originates, as you can see from above, it originates from the lateral third of the clavicle at the acromial end, the acromion, as well as the spine of the scapula. And it inserts on the humerus at a point which I described in previous lecture, known as the deltoid tuberosity. Deltoid tuberosity is just a little bump. Let's see if I can bring it up a little. You can see that little bump there? That's the deltoid tuberosity, and that's where it inserts. And due to its position of insertion, it helps abduct past 15 degrees. So we can see at this angle, right, if the deltoid muscle were to pull on this, it'll just pull the humerus up, so it won't have any effect. So it needs to wait until it gets to 15 degrees before it can actually apply some force in order for it to be effective. That's why we have the supraspinatus up here that raises it for the first 15 degrees, and then after that the deltoid muscle takes over. Now we can also see this large muscle. This is a pretty well-known one, the pectoralis major. Okay, and so as we can see, it originates from the sternum, both on the body and the manubrium, and the clavicle up here, and it inserts down on the humerus. You can't really see it here, but it inserts on the crest of the greater tubercle of the humerus. So the whole purpose of this pectoralis major is to adduct and medially rotate the humerus. So when I've got my arm up here, when I bring it back down, that's the pectoralis major. Now to cover these last muscles, I had to switch to a full body model because I was missing a few, and there's a few main ones. We can see here that we've got two muscles, okay? Two muscles, we've got this first one, and then we've got, you can see that kind of separation there, and then we've got the second one. They kind of look like rhomboids, right? So that's why they're called the rhomboid minor, because it's the small one, and the rhomboid major. Now the rhomboid minor originates from C7 spine to T1, and the rhomboid major originates from T2 to T5. Both muscles insert on the medial border of the scapula. The rhomboid minor inserts above the spine, whereas the rhomboid major inserts below the spine of the scapula. Now the purpose of these muscles, you can see the way they're positioned, is they'll help pull the scapula this way, or in other words, they'll help retract the scapula. Okay, so that's when you pull your arms back like this, they'll help retract the scapula. Now, due to the way they're positioned, they can also pull up on the scapula like this, and so they can elevate the scapula too. Now, we can also see this other muscle here, and due to its position, it can clearly raise the scapula, so suitably, it's named the levator scapulae. Now, the levator scapulae originates from C1 to C4 on the spine, and it inserts on the superior angle of the scapula, as we can see here. Okay, so this is the superior angle, that's where it inserts on. And essentially its main purpose is to elevate the scapula. So when I do this, I'm using my levator scapulae to elevate my scapula. Now, another very important muscle, usually known as the lats, but is actually known as the latissimus dorsi. This big muscle here, originates from T7 to L5 and inserts on the floor of the intertubercular sulcus. So remember, if we take away all these muscles here, the intertubercular sulcus is just here, okay? So that's where the latissimus dorsi is going to insert. Now, due to that position, it'll be able to medially rotate your arms, and it'll also be able to adduct your arms. Now, the final muscle that we're going to cover on level 7 is these big ones here. Very, very well known. They're called the traps, or the trapezoid muscles, okay? They kind of look like a trapezoid, as you can kind of see. They originate from multiple places, so we can see it actually goes up to the head. It actually goes to the occipital portion of the head, or the back of the head up here, and there's a protuberance. Now, if you feel your head here, you can kind of feel that protuberance. That's where the trapezoid muscle originates. See, it originates from this external occipital protuberance, and it also goes down to T12, as we can see. Now, it's obviously split into 3 parts, but the entire muscle originates from the external occipital protuberance, and then it goes from C7 to T12. Okay, and it inserts all these muscles that form the trapezoid muscle. Insert on the spine of the scapula, the acromion of the scapula, as well as the clavicle here. Now, this descending portion right here, this descending portion, is the portion that inserts on the clavicle. This transverse portion is the portion that inserts on the acromion as well as the spine. And then this ascending portion of the trapezoid muscle inserts on the spine of the scapula. Now, each part is going to have a different purpose. This part here, the ascending portion, when we contract it, it's going to help depress the shoulder. So it's going to lower it as well as retracting. Now, this transverse portion, its main action is to retract the pectoral girdle. So it's going to retract the shoulder this way. So when we retract, we do this. Same with the Same with the descending part of the trapezoid. It's also going to retract. But at the same time, due to its position, it can also elevate the scapula like this. And that summarizes all the muscles, ligaments, and bones in the shoulder. Next lesson, we're going to be focusing more between the elbow, the lower arm or the forearm, and the upper arm. We're going to look at the joint between there and go into detail on that. But until then, thank you for watching, and I'll see you guys next time.